Both the last publication and the e-forum promoted by the ILAE were about transition of care from pediatric to adult for patients with epilepsy. So this is a topic that is extremely important in the sense that epilepsies they have two peaks, and one of them is early in life. The other one is later in life. But most of the patients will develop epilepsy in the first 2 decades of life. And about 50% of patients that develop epilepsy during childhood will continue to have seizures as they become adults. So they usually leave the pediatric system and go to the adult system at a time that is difficult for any teenager, let alone a teenager with epilepsy, and with all the comorbidities that come with epilepsy. So epilepsy is not just seizures. Patients with epilepsy often have anxiety, depression, and you have those epilepsies, many of those caused by single gene disorders that are associated with autism, learning disabilities, or intellectual disabilities that are more severe forms. So sometimes they also have motor problems. So patients with epilepsy in general are complex. The degree of complexity varies, and they have to go to a new system, see new physicians, so the new places and new faces at a time of their lives that everything else is already chaotic just because they are going through that teenage years, which is really difficult, leaving their childhood and moving and becoming adults. So they definitely need more attention than what the systems usually provide. One of the things is that many caregivers and patients felt unsupported during this transition or during this period of transfer, let's say. Transition is the term that we reserve for when the process is well done and patients are prepared to move from the pediatric to the adult system and they are follow along. When this doesn't happen, the patients are just transferred from pediatric to adult care. And what happens to those patients that we interview is that the large majority of them felt completely unsupported during this transfer. And they had many difficulties in terms of they often didn't even know who the new physician would be, the new adult neurologist in them would be. They barely had sometimes the name of the physician and the name or address of the new location where they would see the patients. The other problem is that they felt that many services that they had access to when they were in the pediatric care were lost when they moved to the adult care. And this is very important. And this is something that we have seen in other places as well. So in the pediatric system, they have access to a nurse, a psychologist, a child psychiatrist, speech pathologist, and social worker, and this and that. And when they move to the adult system, many times they go to see just the adult neurologist, and they don't have access to the other healthcare providers that they had to before. So that definitely can impact their care. It can impact their seizure frequency, and definitely their well-being. We don't know, but we suspect it can develop the overall social outcome of these patients. There is some old research saying that patients with pediatric onset epilepsy fare much worse as adults than patients with pediatric onset rheumatoid arthritis or even diabetes. And it's possible that if you lose a lot of your healthcare team, you don't have enough structure to go ahead and develop as well as you could socially, financially, and of course, from a health point of view, as you would if you had that structure. In that research we did just now that we published just recently. We had a patient that had epilepsy, was taking 2 anti-seizure medications, and once she left the pediatric system, she didn't have any adult neurologist to follow her. She was being seen on emergency room departments only, and that was all the epilepsy care she was receiving. So completely inappropriate, and unfortunately, this is something we see sometimes. There's several things. So one of them is help the clinicians, the adult neurologists, better understand what are the problems that a teenager with epilepsy has. Other than seizures, we have to broaden our view and understand that they have many other conditions that need also proper care. Ideally, this care and the transfer of care should have been put in place already in the pediatric system before they left. And this is what actually in the e-forum, one of our colleagues was showing. She has a wonderful transition program where all that is in place before the patients leave the pediatric system. So when they move to the adult system, it's much better. So one piece is the adult neurologist just better understanding what are the needs of young adults with epilepsy. The other piece that adult neurologists need to do is to better understand the genetics of epilepsies as well, because now we know many of the epilepsies have a genetic background or an important genetic influence. And so the pediatric neurologists are more comfortable treating genetic epilepsies than the adult neurologists. And this is something we also did research some time ago, and it was very clear adult neurologists are not as comfortable seeing the patients, prescribing medications, or even making the diagnosis, the genetic diagnosis, or ordering genetic tests. So all that needs some education for the adult neurologist. The other part that we have to work on is perhaps empowering patients and families so they can help themselves when they have to move from the pediatric to the adult system. Like I said, my colleague in France has a wonderful system, and her patients are very lucky, but this is not the reality in most places. So a transition program is costly, it's complex, and most places don't have that. So what can we do to teach the patient and the families how to fight for themselves? What are the things they need to know? How can they ask for help so that they have a better, a smoother process going from pediatric to adult neurologist? And then there's the system. So once the whole medical system, and our system is already recognizing the need for better transition of care. But I think once this is better established, hopefully we will have the financial assistance that is needed in order to put in place better transition programs.